Hi, I'm Dr. Pagdin. Today I'm going to try to address some of the frequently asked questions that I get regarding stem cell therapy. One of the things that has come to my attention recently is patients are asking, what is the difference between a treatment with amniotic products compared to what I do in my office? Amniotic products are said to have a rich source of stem cells, and they're supposed to be young cells with lots of potential. And wouldn't this be better than my old, elderly adult cells? Well, the truth of the matter is that amniotic products on the market today contain no living cells at all. They go through a sterilization process where they're freeze-dried and packaged such that when it gets to the doctor's office, there are no living cells in the vial. There's simply some powdered proteins and growth factors. Now, these would be similar sorts of proteins and growth factors that we would get from your platelets. Platelet-rich plasma is a rich source of growth factors. When you attend the office here for a stem cell procedure, we prefer to harvest your own cells, which are alive and not stored or manipulated in any way, but are immediately injected into the arthritic joint. A second question that I get asked is, don't our stem cell numbers decline as we age? And yes, there is some truth to that. So the stem cells that are circulating around in your blood and the stem cells that are present in the bone marrow, they do decline in numbers and in potential as one ages. However, the stem cells that are contained in your fat do not change over time. So they still continue to be numerous and have substantial potential regardless of your age. So in my office, I like to use a combination of platelet-rich plasma and bone marrow and fat stem cells. And in this way, we make sure that we have plenty. In fact, if I take a 10 cc sample of your fat and I prepare that in my centrifuge, that will concentrate in excess of 400 million nucleated cells that we will be immediately injecting into the injured area. Another question is, what happens if I travel to another country? Could I maybe get my stem cell treatment cheaper if I went somewhere else? Well, you obviously have to take into account a foreign exchange rate, travel costs, hotel costs, and so on. If you're traveling somewhere to go and get an amniotic product, which is not licensed for use in Canada at this point, consider the fact, first of all, that you're not actually getting any living cells. Secondly, consider that the cost of the procedure for an amniotic product simply is the cost of the vial of material that the doctor has to purchase. The actual cost of putting it into your body is minimal. In my office, I use delicate surgical instruments with which to harvest your fat and your bone marrow. And these instruments are beautifully engineered, but they are single use only. So they're designed to be disposable. We throw them away at the end of every case. So really what happens is I've got thousands of dollars worth of garbage at the end of every surgical procedure that I do. And clearly this contributes to the cost. So you need to factor that in as well when you're considering cost. Another question I get asked about stem cells is, what about follow-up? What if I have a problem or a complication? Well, if you go to a foreign country and have a stem cell procedure, good luck. There won't be any follow-up whatsoever. You show up in your local emergency room here, and they're not going to know what you've had done. For my patients that come and have a stem cell procedure in my office, they all get my cell phone number when they walk out the door. They can call me or text me at any hour with any problem. My nurse will phone and follow up with them within the next few days. And we do regular scheduled follow-ups. We have the patient come back into the office a month later for an examination and a top-up injection. So we're very meticulous with the follow-up that we offer our clients. So I hope this helps to answer some of your questions about stem cell therapy.